The mental health industry is one. It's been a little bit insane these days, and I would say that it has an inherent insanity. In other businesses, repeat business comes from success, but in mental health, to have your repeat business, they need to keep you ill. Carl Elliott, a bioethicist at University of Minnesota, said the way to sell drugs is to sell psychiatric illness. And that's an unhealthy place to start in an industry, so it's little wonder why they've fallen so far from grace. The business of therapy is one issue at the heart of the problem. For example, if ADD and ADHD were simply labeled an orientation or a trait, for example, no one would pay for therapy or drugs to try and fix those who have the labels. After all, we don't need help if we just consider ourselves a type A personality or an extrovert. We don't need a drug if we might actually like the fact that we don't concentrate on the things that actually don't matter to us. If diagnosed, a child has to live with that label for the rest of his or her life. Never mind that there are talents or abilities that will be missed with the dull lulling of the drug that the child might be on. Never mind that many of the antidepressants we prescribe today are given to people who have, get this, never been diagnosed with depression, and yet we medicate them. And never mind if one day government decides the mental health professionals get to decide which liberties you have, which liberties your child has based upon their labels. Nothing is easier to dismiss than the rantings of a crazy person. The DSM-5 is the go-to manual for mental diagnosis, and the American Psychiatric Association's it takes great new liberties with their new labels. It is this DSM-5 is the primary reference book for many of these professions. When you walk into a clinician's office, the first thing they're going to do after you leave is page through the index looking for your symptoms in search of a label. Now, temper tantrums, instead of being just a temper tantrum, can be called disruptive mood dysregulation disorder. But you say your child is mild-mannered? Not a problem, we have a label for that too. Sluggish cognitive tempo disorder. Grief after a loss or divorce, that's major depressive disorder. Overeating, binge eating disorder. Forgetful? Mild neurocognitive disorder you might have, the new apathy syndrome, internet addiction disorder, and parental alienation syndrome have no basis in empirical literature, according to Fog City Journal. But that didn't stop the experts who compiled the new DSM-5 from adding some handy labels to the manual. No amount of labeling will likely change the fact that the DSM-5 carries a lot of weight with clinicians and also with researchers, psychiatric drug regulation agencies, and don't forget, health insurance companies, pharmaceutical companies, courts, and lawmakers. 8 years ago, fewer than 6% of the U.S. population was labeled with a mental diagnosis. The new DSM-5 will label nearly half of all Americans with a diagnosable mental illness. Imagine for a moment that liberties such as your right to free speech, your right to bear arms, or your right to assemble were suddenly in the hands of the same mental health professionals who've already decided half of us are crazy. There are political and financial reasons that certain interest groups would like to label people with disorders. The federal government has grown rapidly under the last few administrations, and many believe it could use labels that insinuate certain people with certain diagnoses shouldn't have certain liberties. What about that label, major depressive disorder or post-traumatic stress disorder? About 90% of our military who have seen combat are subsequently diagnosed with PTSD, so they will be among the first to have their liberties ripped from them if we allow the mental health field to decide who gets to keep their liberties and who doesn't. Many of our military have fought with weapons on foreign soil, yet it's those same soldiers upon returning to American soil that could lose their right to own a firearm if they experience PTSD. They could lose other rights too. If a gun is considered a lethal weapon that is too dangerous for ownership by a combat veteran with PTSD, then what about an automobile? A bat? Cutlery? Restrictive labels could include ADD, seasonal affective disorders, mood disorders, personality disorders. The list goes on. Even if you don't have a label, what if you belong to a group that the mental health professionals decide is inciting or hate-provoking? Could you lose your liberties for having your memberships? We're going to discuss all of that today on Smart Life with Dr. Gina. You stay tuned. In the opening segment today, I warned about obsessive labeling in the new diagnostic Bible for mental health professionals, the DSM-5. For comparisons, if you needed 8 symptoms with the DSM-4 to be diagnosed with a problem, now you might only need 1. Obamacare will massively add to that number. For example, say your child mentions being down over a bad semester in school or a bullying issue. The doctor now must encode that. He might encode it as depression, and it goes into your child's permanent record. So then you have to ask yourself, will she later in life be able to own a gun with a diagnosis of teenage depression? What about postpartum women? What about midlife crises? Could that all be labeled as some sort of mental problem? The Citizens Commission on Human Rights initiative says that while even key DSM contributors admit there is no scientific or medical validity to the disorders, the DSM nonetheless serves as the diagnostic tool, not only for individual treatment, but also for child custody disputes, discrimination cases, court testimony, education, and more. The DSM is driven not by science, but instead caters to the pharmaceutical industry, the commission stated, and they also said that with its expanding list of mental disorders voted into existence now, not discovered as in real medicine, for each of these, a psychiatric drug can be prescribed and insurance companies are then billed. That big formula spells big profits for psychiatrists and for drug companies, and this has been exposed more recently with a U.S. Senate Finance Committee investigation that I read about. They studied the APA itself and the fact that about 56% of its $12 million a year income comes from, guess who? Drug makers. According to the U.S. National Library of Medical National Institutes of Health, about 72% of prescriptions for antidepressants are given, get this now, without a diagnosis at all. How can you, I would ask, prescribe a fix if you haven't even figured out what is broken? In any other field, that would be malpractice, clearly. If a doctor, for example, prescribed morphine to you without a medical diagnosis, he'd have his license revoked and he'd be sued. But in the mental health industry, it's standard operating procedure because they simply don't have a lot of answers. So soft science, good guesses, hopeful doping has become common practice in mental health. Carl Elliott, a bioethicist, says the way to sell drugs is to sell psychiatric illness. Kelly Patricia O'Meara, a former congressional staff member familiar with the FDA DSM coziness, said that drug companies pull a mental disorder out of the DSM hat and they get FDA approval to use an already existing drug to treat it. Well-known psychiatrists are enlisted to publicly affirm the disorder as a social problem. Voila, confirmed psychiatric illness and magic pill. For the so-called mood disorders, now you're not going to believe this, 100% of the DSM panel has financial involvements with drug companies. Sales for drugs prescribed for those disorders, by virtue of their inclusion in the DSM, they reach more than $80 billion worldwide, according to the CCHRI report. The most vulnerable, of course, minorities, children, women, and the homeless. Each time there's a shooting, people say, we need more research into the mental health of these shooters. Do we? Well, let me give you a statistic. Only 4% of violent crimes are committed by people with a mentally ill diagnosis. We're not going to diagnose our way into safety, said Dr. Gary Greenberg, a psychotherapist and author. And I interviewed right here on this show clinical psychologist Dr. Dathan Paterno, who said that he's witnessed many patients hospitalized against their will. He said the psychiatric establishment has enormous power. The power to label brings the power to hospitalize and to prescribe forcefully if deemed necessary by the psychiatrist. This power metastasizes into denial of liberties. For example, he said he knows several veterans who can no longer own a firearm simply because they were hospitalized, often for PTSD. And often this was due to medication errors. Ironically, medication errors that were caused in the first place by the psychiatrist. Get this, in 1952, the DSM was a tiny little spiral-bound notebook. By the time there was a fourth edition of the DSM, it was almost 1,000 pages. Some say this is the slipperiest of slopes because of all the drugs being prescribed for the ballooning number of disorders being diagnosed. They all, each and every one of them, has side effects. So what is a chemical imbalance anyway? And is there one chemical that can be given in order to balance the chemical throwing off the balance? Well, there isn't that I've ever found. Little chemical data is actually ever even analyzed, and that which is analyzed often has inconclusive results at best. But that doesn't stop mental health doctors from prescribing chemical solutions to their unproven chemical imbalances, a term which, for all I can tell, was just literally made up. Many times, these unproven drugs are prescribed for a mental disorder without therapy as well. So now you have a drug given, a side effect for something that may have never even existed, and the person's not even getting therapy, only drugs. Often, therefore, the patient goes from mildly disturbed to drugged with side effects, and the combination makes the patient worse, not better, and sometimes a lot worse. The trend is shocking. You ever heard of the National Alliance on Mental Illness, NAMI they go by? I know this group. I remember when NAMI visited the Capitol, and they were the political bullying arm of the mental health lobby from my days alongside my husband in the Senate. In my opinion, they'd bring people through with all sorts of mental problems. They'd parade and exploit them in order to what? Perhaps get more money? Well, listen to this. According to the New York Times, a full 75% of NAMI's donations come from where? Big Pharma, directly. It makes sense then that NAMI, the same ones who paraded these victims through the Capitol building to impress legislators to give them more money, NAMI opposed black box warnings on the antidepressants that led to suicide in children. They also opposed black box warnings on ADD and ADHD drugs that cause sudden death in children, along with stroke and heart attack in others who took the drugs. The Times also reported that psychiatrists in Vermont and Minnesota received big gifts from Big Pharma. In 2007, payments from Pharma rose 600% in the years they studied, and prescriptions for children's antipsychotics increased 900%. For measure, that's more than 6 times the rate that the same drugs are prescribed elsewhere, even though those numbers have increased as well. Tell me the money had no impact. This begs the question. Are children in the areas studied in the U.S. that much more psychotic for some reason? Or is it the field of mental health that is in total corruption and decay as a so-called healing body? The layers of corruption and potential for liberty infringement opportunity goes way beyond the scope of what we can talk about here on the show today, but I thought it important to introduce you to the tip of the iceberg that we approach when we say the problem is the mental health industry. Until the mental health industry learns to get its own house in order, it has no business making or even impacting public policy any more substantially than it already does. Insanity pleas, criminal defenses, child protective cases, etc., etc. Mental health help is about the slipperiest of slopes. Perhaps the answers lie deeper in our culture and in our human mind. I would argue they might be spiritual and cultural. Thanks for tuning in. You go boldly now and live the smart life.